what else could we do if we had just all the data exhaust off of a human being, you know?
This kind of sounds a little bit dystopian, a little bit Black Mirror.
We're missing a whole innovation layer around our personal data. Everything from what we eat in the mornings, where we run, where we walk, how we work out, our health outcomes, our Ring data from Aura, our Apple Watch data, all these data streams that's currently useless could be put on chain and used in just these incredibly creative ways. The most valuable thing out there is data, and we have it. We're just throwing it away.
I think being able to simultaneously earn a passive income stream through tokenization could be interesting, whilst also improving global health outcomes. I know it's also incredibly idealistic, but I think you have to think in this way in order to actually make progress.
Soon, genomes will be cheap enough. It cost me like $600 to get my genome sequenced a couple of years ago. I think it's probably close to $100 now. Very soon, it's going to be cheaper than a meal to get your whole genome sequenced. And that data is going to be out there. And the question is like, where do you want that data? And so is your browsing data, so is your activity data, and where do you want it? Hi, everyone. Welcome to DeSci Pilled. I am your host, Ryan Bethencourt. We're really excited today to have Eleanor, who heads up DeSci at the Sei Foundation. You may have heard a lot about her recent bid for 23andMe, a lot of the incredible work that she's doing at the Sei Foundation as they are developing an entire ecosystem around DeSci. As we dive in, again, it is never financial or medical advice, or in this case, we might talk about theoretical physics, never theoretical physics advice. This is edutainment. We are all learning on our path through DeSci. So Eleanor, thank you for joining us. Would love to hear a little bit more about yourself and your journey, right? How you basically kind of found yourself in as the head of DeSci for the Sei Foundation. This is really, I think actually you might be the first head of DeSci for any major L1. Is that accurate?
That would be accurate, yes. It's a big boost to fill.
Yeah. So we'd love to hear your journey. I know you've been deep in, I would say you're a DeSci OG. You've been around for a long time. I think the original kind of entry in was through LabDAO. And so we'd love to hear, and I know there was some fashion modeling along the way, right? So the arts and the sciences combined. So we'd love to hear your story too.
Yeah, thanks, Ryan. And thanks so much for having me on the podcast. Big fan. And I really, really like what you're doing. So hey everyone, I'm Eleanor. I'm head of DeSci at Sei Foundation. And again, like no financial advice. This is all kind of, just riffing.
Riffing, edutainment, all that sort of stuff. We're all learning together.
Exactly. So, I guess where do we start? So I initially started out my career, having studied languages, and then had always had this, real morbid fascination for biotech innovation. Like I'd be reading as many biotech papers I could get my hands on, particularly in the field of longevity. So it came more from a passion point of view that I ended up getting here. I guess, so first started out in biotech and healthcare consulting for private equity at Marwood Group. And it was actually through German, so I speak German fluently, that I ended up, kind of getting into that part of like finance and biotech, et cetera. This was during lockdown. And so somebody sent me a article about DeSci, actually. It was around about 2021, 2022. It was written by Sarah Hamburg, actually, and I rabbit holed so hard that I, long story short, decided to make a career out of it.
Which is wild, right? Back then, most people hadn't even heard of DeSci, so it's wild that you kind of stumbled across an article about DeSci by Sarah and then just got involved, right?
Exactly, yeah. So it was around that time that I was working in on deck. So I was working in fund operations. So was kind of looking at basically how you build a accelerator / venture studio, how you code it, also how you diligence companies, looking at different applications of technology across all sorts of different fields. That's also where LabDAO came in as well, and where like the initial connection was made. And yeah, basically I decided like I think this has to be the most compelling application of crypto that I've seen in a long time. So,
and Eleanor, what is or was LabDAO? Because I know now it has a new name, right? So what was it back then?
yeah, exactly. So LabDAO back then was basically like a decentralized Emerald Cloud Labs. So like democratizing access to compute for scientists, also citizen scientists, researchers, etc., via a global online community. It was one of the first BioDAOs to spin out.
And just for everyone's clarification, so the kind of the Emerald Labs is a robotic lab. So it's basically like, you can kind of, it's kind of almost like an AWS for robotic lab work, right? They're an incredible company, and they're doing really incredible stuff. And back then they were doing really incredible stuff. And so that was really bringing automation and robotics in the early days to biotech too.
Exactly. But with more like a crypto Web3 kind of component and basically bringing the community of users online. So it was following LabDAO actually that I'd been, kind of in the VitaDAO community, have been tinkering and
so you were in LabDAO and then you were also like tinkering in VitaDAO. Like, and by the way, I think this is a really important part to kind of highlight about the interconnectedness of all the DAOs and all the DeSci communities too, right?
Yeah, exactly. So, I mean, I really like the fact that there's this whole kind of sense of collaboration between the BioDAO communities. And so LabDAO was also doing something with one of VitaDAO's projects. So it's the Victor Korolev project, Autophagy activators.
Okay.
Yeah.
And why don't you explain that for we have a lot of people, some are scientists, some are crypto people. So what is autophagy, and like why is that important for longevity for us?
Yeah, so at a high level, autophagy is basically what happens whilst fasting. And so the Korolev lab was looking at certain hits that induced autophagy in humans, and then basically developing those key molecules into something that you could basically build a company around. So that's translational research, and that was kind of the focus of VitaDAO whilst I was there. So it's kind of like developing pre-IP research into something that's translational, coming in at the point where you can get the highest value inflection and basically build a team around that and then develop that into something that could potentially change the status quo for human longevity.
Yeah, and that's really promising. So autophagy, for those of you that may not have a biology background that are listening, it's like our cells make proteins, and sometimes the proteins get worn out, and instead of getting replaced, we just keep using them. And so that's why, like with fasting, you actually your body has times and your cell has time to kind of go back and replace kind of the slightly less functional proteins. And it kind of makes sense, right? If you think about it as molecular machinery, these proteins aren't working as efficiently or as well as they should, and they'll make like mistakes and errors. And that's when you start to get damage in the cell, and things don't work as well, and that may lead to damage, long-term kind of aging damage. And so the theory behind that is you replace these worn out molecules and proteins and enzymes through autophagy, and there's actually like a recycling program within your cells that actually happens. It is exquisitely complicated and probably some of the most interesting biology you'll ever learn. So I highly recommend, for those of you that are not familiar with it, to look into it. It's like wild. I often compare biology and cellular biology to like alien technology that landed on this planet and we hardly understand it. So definitely look into it. So that was a really promising thing. So you kind of worked on that project with VitaDAO, and then how did that evolve, Eleanor, for you?
Yeah, so basically I was brought into VitaDAO back then, like the only full-time person working there. to
Which is also incredible, right? For those of us that love VitaDAO and VitaDAO and all the things that they've developed and all the new IP that they're developing, one of my favorites is the collaboration they're doing with Pump Science testing longevity compounds, which is, I think, a whole bunch of them are going to be launching, I believe, next week. So, so I don't know if that I'm supposed to say that or not, but like I think they're launching next week. So we'll see when this airs. So it'll probably have already been launched by the time this airs. I think it's like 17 new compounds. So
nice. Yeah, I think like it's awesome, especially VitaDAO, because it has such a huge community, and it's awesome to see like what the power of community can do, and just have like so many things cooking at one time. And then once the operations and management of the community, DAO, etc., is like ironed out, you can accomplish a lot. So that's
what surprised you the most with that community, because you were employee number one basically, right, for the DAO. And so like how was that? I think for many of us, we'd probably consider that like either first hire or first founder, lots of different ways to view it. And so how was that? Because you're going in, I mean, it was very new, right? Like for most of us, we're still, honestly, in the crypto space, we're still figuring out how DAOs work, and they work in lots of different ways.
Yes, I mean, I think the first thing that took me aback was just how incredibly talented the community is. And so like you're working with industry executives who've built, scaled, exited multiple biotech startups, and just being able to work alongside these people who are basically like working in their free time out of interest as well is just incredible. So it's a massive leveling up of knowledge in the industry and skill set. And I think also just the stickiness in the community as well, especially for longevity, was just like something I'd never seen before. And really, really cool.
Yeah. And the whole community, I think for a lot of us, like, one of my favorite quotes, I think it was from Chris Dixon, who was formerly with A16Z, probably one of the most interesting thinkers in Web3, wrote a great book, Read, Write, Own. Highly recommend it. Great book, talking about Web3. And he basically says, watch out for what people are doing at the weekend, really smart people are doing at the weekends as a hobby, because those things become industries, right? And I think, that is where we are with DeSci, right? Like DeSci is primarily something that really smart biotech entrepreneurs, PhD students, hobbyists, professors do on the weekends, because it's something that matters to them or they care deeply about. With longevity, obviously that's a category that I think many of us care deeply about. One of my good friends, Aubrey de Grey, I was at Cambridge University with Aubrey when he was in the Fly Labs. So I was doing my master's and he was in the Fly Labs at Cambridge. And so it was just kind of wild to see that evolution of the whole longevity space over the last, it's been a long time, many, many years. And so, I think that for us and where we're going with DeSci, I think it's really interesting. And by the way, just as a little side note for the listeners that may be scientists, DAOs are decentralized autonomous organizations. They are kind of like a company, but this very amorphous thing that's also a community. Look it up. It's really incredible. It has been used heavily in the crypto space, and it's now starting to be used in the DeSci space, the decentralized science space. So, and Eleanor, so from there you went on to Cerebrum DAO, right? Like the mind. So you're basically going from decentralized autonomous robots and lab work to longevity, and now you find yourself in the mind, the brain, like some of the most interesting mysteries to humanity. How do we think? How do we fix diseases of the mind? Things like that, right?
Yes, I mean, it's a really fun, like, kind of career arc, to be honest. And I do find that, so the human mind, like, and also our perception of reality is one of the next frontiers, aside from AI, robotics, space, etc. And so we worked on some really cool projects, both in the biotech space and also consumer healthcare products as well. I think, yeah, what was particularly interesting was being at Cerebrum during the DeSci bull run and just kind of seeing this like frenzy of interest, I think more than anything in what DeSci is doing. I also think it's brought in like a number of new incumbents. And yeah, I think December was a great month for everyone and a really, really great spotlight that DeSci needed.
It was mind blowing. And in terms of the projects that you worked on, these were kind of like consumer products, right? Like consumer nootropics, or could you tell us
Yeah,
about those?
yeah, exactly. So one was called Perceptor, which is based on a combination of cat's claw and oolong tea, a number of other patented products that had promising data for relieving mild cognitive impairment. And so what we were looking at was basically doing a observational study in order to confirm the efficacy of these supplements, and then eventually, basically, this would have led to building an online product marketplace where community members, holders of the Neuron token, would have been able to access these types of products at a discount and also provide feedback, data, etc., on the efficacy of a product.
And what's powerful about that, for a lot of people that aren't familiar with drug development, mild cognitive impairment is everything from a bit of confusion to the early stages of like Alzheimer's, right? And so it's before someone has full-blown Alzheimer's. And so it's really powerful if you can get in front of that and extend people's like healthy mental lifespan, with products. I think, the line between, consumer and therapeutic is so thin in so many ways. I mean, these are just small molecules, peptides, things like that. And so that line is really a regulatory line in many ways, right? It's less about the individual molecules and much more about what do regulators think is a drug, and what can be approved as an over the counter or consumer product. Um,
Yeah, exactly. I think it's such a shame that so many high potential products are unable to commercialize because of this kind of gray area between of like regulation. And I do also think that DeSci and the power of community that is inherent in crypto as well can be super powerful in order to um yeah, I guess prove better efficacy in a decentralized way.
Yeah, and dramatically reduce costs, right? Like, I think when we're looking at the DeSci community, you can reduce the cost by like 10 to 100x the cost of running some of these very expensive human clinical trials, because you can actually have, the customers are the patients, and that meld, and the community and the people that might benefit. And so it's incredibly powerful. I mean, some of these studies can literally be hundreds of thousands of dollars to millions of dollars per patient. And so if the community is the patient community, people that care deeply and are basically, I don't know, patient entrepreneurs, right? Patient community members, you can really transform the economics of drug development, which today, I think it's over $2 billion to develop one drug, which is just crazy. Um, Especially because there's so many new innovations around AI, N of one studies, decentralized clinical studies to like dramatically reduce costs. And the FDA has not yet caught up with it. I would say that it's looking very promising and exciting, right? That the FDA is starting to sound like it might start embracing innovation, which would be incredible, because most of the world relies on the FDA. And because the FDA has been sclerotic, and approving literally a couple of dozen compounds or therapies per year max, it's been a massive bottleneck to innovation.
Yeah, I think that DeSci actually really tackles that pretty head on. I think, there are a number of different parts of DeSci that I could talk about, but I think so the likes of Infinita City and also what they've been doing in Montana, for instance, and expanding the right to try bill is a key piece of DeSci, which is bringing drugs to patients more quickly. That I think is sometimes overlooked.
And
And
Eleanor, give everyone kind of an overview. Right to try, it's something I'm huge supporter of. It's a right to try a drug, right, that has not yet been approved, but may be able to help you, right?
it's falling. Yeah. Yeah.
because a lot of people, unfortunately, a lot of people die with drugs that are currently in development that might be able to help them. And so, this is this huge untapped opportunity. The FDA is always risk adverse. No one gets fired for approving a drug, not approving a drug. People get fired for approving a drug if there's, even if there's large benefit, if one person gets sick or gets hurt or dies, they might get fired. And so they become a risk off agency as a result. And we don't see the cost to lives that are lost because drugs aren't available, are not approved. We only see what's been approved, right? And so the right to try bill is exactly that, right? It's a way of accelerating therapies to get it into people's hands before the FDA has regulated it.
Exactly. And so there are a number of other special economic zones which are kind of looking at something similar. For instance, Prospera. I know also the Bahamas are looking at doing something similar. But I think what's really, groundbreaking about Montana is that this is already in the US, and it's basically the right to try from, I guess, like the national level delegated to the state level at a high level.
Amazing.
Yeah, you can
Montana has been a very innovative state in general, I think, for crypto, and it's awesome to see them getting innovative with biotech as well. It might be a super powerful. I think DAOs are legal entities in Montana too. I think they have laws around that, right? Where in Wyoming they've made DAOs legal entities.
Wyoming. I couldn't really put a comment on Montana,
Sorry,
but I believe,
yeah.
similar-ish.
Similar-ish. My apology. Yeah, exactly. So, all right. So that leads us to this broader space, right? So you kind of went through this. I mean, it's kind of an OG DeSci journey, and then you became head of DeSci at the Sei Foundation. So tell us about that, and then of course launched a $65 million fund as well called the Sapien Fund, which I am an advisor. Just for full disclosure, thank you, Eleanor, for inviting me. So I'm a DeSci advisor. So tell us about that journey, Eleanor.
Yeah, exactly. So, I mean, I've been doing a lot of research in the DeSci space and also just kind of putting my thoughts out there. I think on, basically over X and also conversations as well. And basically I ended up just having a conversation with someone from Sei about DeSci, and then next thing you know, like we're jamming on potential applications, what I find works in the space, what doesn't, areas of opportunity, and basically brought it all together. And now I'm here at the Sei Foundation, heading up the DeSci ecosystem. And so part of that was basically formulating the DeSci V2 thesis, which is my core, I guess, thing about DeSci is that I want it to go from ideal to real. So generating real world impact in the sciences. Also expanding the definition of what DeSci is. So going from traditional biotech all the way to consumer, health tech, athletics, even infrastructure. And of course, we have the Sapien Fund, which is 65 million and the biggest fund in DeSci to date. I believe, so at the time of the launch as well, it was more capital for DeSci than has been allocated in DeSci so far. So we have quite a lot to play with.
Yeah, which is incredibly powerful, right? And I know we're talking about your vision about where things are going. We're going to riff a little bit on unusual science, right? I think I wanted to kind of share this awesome T-shirt. This is Paul Firebender. He was a philosopher, talked about the philosophy of science. It was actually awesome swag from Heterodox Labs. If you haven't seen them, check them out. But basically, it was about how the methodologies in science are not fixed, and how it's so important for science and art to be combined. And I think with your background, Eleanor, I mean, this is very timely that you are now heading, the largest DeSci fund and, the largest push for any layer one into decentralized science, right? And you are combining arts and sciences and crypto too. And go ahead. Yeah.
Yes, I mean, just to add to that as well. So basically, Sei itself is kind of positioning itself as the decentralized Wall Street. So you have the speed of Solana, soon to be the NASDAQ once Sei Giga is pushed, with also the mindshare and infrastructure of Ethereum. So it's fully EVM parallelized, which basically means that if you are already building on Ethereum, the switch to basically bridge over to Sei or to go Sei native is actually super minimal. Also positioning it as more of an innovation lab. So not only DeSci, but also AI, robotics, frontier technology, DeepIn as well. And really, it's the only chain that's out there that's kind of positioning itself as this kind of, innovation lab chain. And so building out a big ecosystem that supports all this. So it's really exciting, actually.
That's incredible. And labs too, right? And so I know when we've talked in the past, you're always open to anyone reaching out if they have great ideas that they want to build on the EVM, but moving fast. I think it's 10,000 TPS at the moment. Is that roughly right, Eleanor?
Off the top of my head,
Yeah. So it's fast. It's a very fast chain, and it's an EVM, so an Ethereum virtual machine. So if you know how to program Ethereum smart contracts, it's going to be really easy to use, right? So so in terms of like riffing on some of these ideas, I know with heterodox, their focus is actually bringing anarchy and some lack of orthodoxy to theoretical physics, right? And when Alex first told me theoretical physics, it kind of blew my mind, because I was like, okay, string theory, black holes, that's not weird enough. And apparently no, academia has kind of put a straitjacket on the strange thinking and innovation that has happened in academia and theoretical physics. And so it made me realize, like, we're about to see a proliferation in decentralized science of just wild and interesting ideas, right?
Yes, I mean, I still think that DeFi, the applications of DeFi in decentralized science is king. And so what I really like to see is like an on-chain school of Athens where new, perhaps heretical ideas, for instance, like under the scope of theoretical physics, for example, is more easily funded. You basically, launch an RFP and then raise funding, almost like a kind of Kickstarter campaign. And then you're able to share the findings with a broader community. So the stone walls, I guess, around the research community are kind of brought down and democratized a lot more. I think it can also do a lot for the likes of STEM talent or new interested students who are wanting to explore STEM sectors could be a little bit more interested and just also be a lot closer to researchers, research outputs, also applications in industry. So I kind of see it as well as like not only democratizing access to funds and also making the process arguably a lot quicker, but also the second order of kind of consequences that you're making the sciences a lot more attractive for new talent, especially women in STEM. I know it's like always a big push for that, but just kind of making it a lot more accessible.
Yeah. And the liquidity layer is one of the powerful things about crypto, right? Like really combining science with DeFi, so you can do decentralized finance, because in the era that we're in, I mean, we are seeing public funding for science decrease in the US. I think the dirty secret here, I think for most people that probably weren't aware of it, is science really didn't get a lot of funding in multiple different administrations. So for decades, science has really stagnated in terms of, publicly funded science has really stagnated in terms of new capital being brought in, right? And so, yes, right now we're seeing a decrease in publicly funded science. I'm always for more funding for science, but it wasn't like a flood that was happening. And the U.S. and Europe and most Western countries, science funding has somewhat stagnated, which I think is very surprising for a lot of people.
Yes, I mean, it really is a shame, but I do also think that there are other sources of capital out there. But I think the way in which research groups are funded, I think it needs to change, because the world's becoming more and more online. And I think a lot of these So philanthropy organizations are a lot kind of older, a little bit more institutional. So if we were able to basically bring this online, do funding on chain, and also just be a lot closer to research outputs, I think it could also just like build a lot more trust, I think, between funders and researchers. And yeah, I mean, I just kind of want to make science, technology, information, also prevention for any future healthcare problems, kind of harking back to longevity here, just make it a lot more accessible than it currently is.
Yeah, I mean, one of the, I guess, tying this in with, you recently made a bid for 23andMe, right? To acquire 23andMe. And, the idea of having our data that we control on chain is just so powerful because then honestly you could monetize it. You could basically say, well, look, this is my data package. I am willing to allow access to it, maybe, anonymized or whatever else for a certain price. And all of a sudden, your personal data has value. It can be protected, and you know exactly who has touched your data and for what reason. Versus, right now, our data, and that includes my data as well. I know it's probably been leaked. Actually, I'm certain it's been leaked. Out into the broader web. But it's held in a database that was owned by a company, and now it's going to be owned by Regeneron, right? And so I actually like Regeneron, but like I don't know what they're going to do with our data. Like I have no idea, right? And so I would love to have control over my data. And so could you tell us about your thinking around that? Because like bringing our data on chain, that's just the beginning, right? Just our SNPs or our genomes is just the beginning.
Exactly. So I think the thing that really, I think that the thing that crypto really needs is also just a bit more understanding as to how it could potentially impact the sciences and also how the applications of Web3 could be used for a lot of good in terms of user data management. So yeah, sadly we weren't successful with the deal, but I mean, I think adding a crypto layer to the 23andMe build would have been it would totally change the status quo. So, for instance, users would be able to see who wants to access their data, what it would be used for, just kind of riffing examples here, and also have the right to consent whether or not their data can be used or not. Every time a sale is made, for instance, you might see like a passive income stream from any acquirer, and there'd just be, again, like kind of roofing ideas, but there'd just be a lot more transparency and trust over how your data is managed, who's using it, and also be able to do a lot more good with it as well. So I think being able to engage with research institutions and also say patient advocacy groups and utilizing certain data sets for doing more research on rare diseases, for instance, and just being able to have a lot more visibility over how that's used also for good would just be, I think it'd be a total game changer. We're also still in this world where owning your data is still very much part of the narrative. I do also think that needs changing. I'm also very confident though that there are many other applications where the thinking around the build for 23andMe can be applied. And again, like if anybody is working on something similar to this, I would love to chat.
Yeah, hit up Eleanor. I mean, one of my frustrations, Eleanor, with 23andMe was honestly the lack of data. I know it may sound crazy for those that have used 23andMe, but we had this SNP data, and I have had my genome sequenced, and it's one of the hardest things to actually get analyzed. You have all these really clunky old open source software, and then the stuff that's like really expensive and bespoke, and honestly probably not usable by the average person. And so, if we were able to unlock our data, and honestly, I would pay, whatever USDC, certain amount of USDC to have a program. So this is bringing in AI and smart contracts to analyze my genome or my SNPs from 23andMe, which I did download, and tell me more about myself, not just ancestry and some interesting genetic traits, but it's like, what about today? All of the information that we've seen today that are in papers and that we know AI, I mean, the latest iterations of ChatGPT or Grok, are just incredible and would be able to provide us with more information. And so, like, we're missing a whole innovation layer around our personal data, everything from, what we eat in the mornings to where we run, where we walk, how we work out, our health outcomes, our Ring data from Aura, our Apple Watch data. Like, all this stuff is like all these data streams that are, data exhaust that's currently kind of useless, could be, put on chain and used in just these incredibly creative ways, probably ways that we haven't even yet thought about. Like, some fun consumer ideas, like, if you know where everyone is running and where people enjoy the runs the most and they rate their runs, why don't you, have a run app that suggests great places near you where people get a great workout? I want a hard workout, I want a light workout. Okay, great. Here's a suggestion. And that would could be an on-chain innovation. And the people that are going and running, they get paid in some kind of tokens for the data around their runs, or their genomes or whatever else. So there's just all of this like consumer innovation and medical innovation that's just missing. And data, we now know with AI, right? AI, the most valuable thing out there is data, training data. And we have it. We're just throwing it away.
Yes, I mean, I think there are a number of potential applications that could be built on top of the 50 million data set. I also just want to clarify, though, that none of the actual data, DNA data, would be stored on chain. That would be that would be no bueno. Rather, so the intention is basically to use enterprise level storage, and we also wrote a blog that spoke about the number of potential applications in order to build basically a privacy layer around how data is accessed. But to your point, I do think that there are a number of health applications surrounding preventative health and longevity that utilizes the on-chain component, the crypto piece as well, where you're basically gamifying health outcomes and living a healthier life through better access to information on basically how to do that. There's also a lot better personalized, and also potentially earning a passive income stream as well. So this goes into, say, emerging markets, for instance, where there are number of diseases, for instance, which may be super easily treated. And I think being able to simultaneously earn a passive income stream through tokenization could be interesting, whilst also improving global health outcomes. I know it's also incredibly idealistic, but I think you have to kind of think in this way in order to actually make progress. So that's also another idea, which I think is super cool.
Yeah, I mean, Eleanor, it's building for the next for the next 8 to 10 billion, right? Like that I think that is the global thinking, and there's value everywhere. That is, this data exhaust that we know these training sets, like with, Tesla. One of the reasons why Tesla has such a lead is because they have all the training data to make autonomous robots. We're going to see robo taxis in things like 2 days. We're going to see robo taxis in Austin, and these are all, self-driving, really autonomous vehicles. Like, what else could we do if we had just all the data exhaust off of a human being?
It kind of sounds a little bit dystopian, a little bit Black Mirror. You could have like a digital twin, but I think there's also just a big ethical component as well that goes into this. So,
Eleanor, you just gave me this crazy idea. You could have a digital twin of yourself, and that digital twin, before you even get up, the AI is modeled, 20 different ways your day could go, right? And suggests when you wake up, you have 3 options. How are you feeling today? Hard workout, light workout. This is what I'd recommend, right? Like, and you could just start imagining like optimized you, I don't know, Optimizely or something. Like, we could come, and then you wake up and it has a whole schedule for you depending on how you're feeling or the direction you want to go that will optimize your health. It's kind of wild to think about that, right?
Yeah, I'm just like thinking, what could you That's quite cool. That's quite cool. Yeah, I'm thinking like it could help you with like blood sugar levels, for instance, if you're diabetic. It could also help with hormone levels. It could
Hey
also help
Ryan, take
with,
take the
yeah.
stairs this time. Don't take the elevator because the stairs actually help lower your blood sugar level. And you're like, okay, it might even be in our ear, right? Like and it's all built with the data, right? Like this interplay between AI, data, crypto, back and forth.
Yeah, so I know Stadium Science was doing something kind of well, not similar, but maybe like a precursor on sleep scores, quality of sleep, and also just gamifying, yeah, like your own ability to sleep well. And I think that it's like a leaderboard and everything, and I think that was pretty cool. We
I
can
mean,
like build.
Eleanor, like think about that. Optimized with all of your data. So if you could take maybe it's like a ZK proof or something, right? And it finds that your data set looks a lot like someone else's data set who's had really great sleep and you're not having great sleep. And it can recommend, by the way, this person who has great sleep walks 3 miles before they go to bed. And then they have a great rest. And their genetic profile, their metabolic profile looks like yours. Right? Like wild, right? Like wild.
Yeah, I think isn't Brian Johnson doing something with his Don't Die school? I know he was doing like an NFT passport, but I wonder if that might be something like for the longevity maximalists among us.
He did, yeah. Brian is a friend of mine. I've known Brian uh for a while, and I love what he's doing. I'm a big fan of plant-based diets. All of his products are plant-based, but obviously based on science. I love that he's using himself as like an N of one to experiment. But I know he's building his community with kind of this on-chain kind of Discord. I'm in the Don't Die Discord community, which is great. Highly recommend it. Um, and they have meetups and things like that. But I think it's very early in terms of like what would we call it, right? When you start putting your health data, your what would we call that? I mean, it's DeSci, but what would we call that? Like it's a kind of like a quantified self, but on chain.
Exactly. Part of the DeSci V2 thesis, actually.
Oh,
And so,
DeSci. There we go. DeSci meets you. There we go. The perfect, Eleanor. Perfect. Perfect. DeSci
yeah.
meets you.
So,
There we go.
yes, I mean, I think, yeah, you're right. It is super early, and I think we've yet to see like how the crypto on chain component could be the most effective. I do think that, getting implementing like a little bit of a gamification kind of thing is, and also just like the passive income stream is super cool. And I think that there are a couple of projects that are trying that out, and some are working pretty well, some are others. I think we're still kind of early though, so yeah, I think it'd be definitely an interesting thing that I'm keeping an eye on like, this year. I
Yeah,
think like the whole consumer health angle is a piece of
the
DeSci, which
integration is powerful, right? When you start to like layer the integration with like just not just one aspect, not just your walking and running, but maybe your genome or your SNPs or your sleep outcomes. And then, a lot of people are probably like asking, well, why do you have to put this data on chain? A multitude of reasons: accessibility to your data, to make sure that situation like 23andMe doesn't happen where another company buys your data. I think for those of us in the consumer space, it's like soon genomes will be cheap enough. I think it was expensive, but it cost me like $600 to get my genome sequenced a couple of years ago.
okay.
I think it's probably close to $100 now to get a consumer grade genome screen sequenced. So like very, very soon, it's going to be cheaper than a meal to get your whole genome sequenced. And that data is going to be out there. And the question is like, where do you want that data? And so is your browsing data. So is your activity data. And where do you want it? Right.
Yeah, exactly. So, I mean, do you want your data to go into the hands of some anonymous third party that you actually paid for the service of them using and then selling your data? I mean, when you put it like that, I'm not so sure. Or
Mm-hmm.
would you like to be in the position where you have ownership, management over your data. You get to see who uses it, how it's used. You can also even supplement it by, like having real-time insights to your activity, your biometrics data, for instance, and be able to live a healthier, better, arguably life, whilst still maintaining sovereignty over yourself. I don't know.
I mean, I would love to have access. One of my frustrations is a lot of people don't know this. The FDA regulates certain types of software that you're allowed to use. So, let's say, there's a biomarker for heart failure and it works, right? It's like 95% predictive. The FDA will regulate that versus you having access to your own data, just doing a quick blood sample and going, hey, run this through, and now I've got my data. And I don't like that. I would much rather honestly do geo arbitrage, have a smart contract somewhere that will run that for me and cost me a couple of cents to do the work. Maybe less than a cent, who knows? But like, I would love something like that. And I would love it to be outside of the control of any one government, because some governments are even more restrictive about what you're allowed to know about your own body. And to me, it feels like that's wrong, right? We should be able to know as much as we want about our own body, and honestly, probably as much as we want to do to our own bodies to treat ourselves, whether it's longevity or to try and get in front of various different conditions that people have and test things.
Yeah, I agree. I mean, imagine the number of lives that have been lost because you just haven't known about a particular genetic trait or disease, like age-related disease. And also you just didn't have the information or the access to a specialist, for instance. If you were able to basically bring this back into your own hands with the help of having like a decentralized specialist community, for instance, or I don't know, being able to have like an AI automated like co-pilot that helps analyze your data and tell you like your health insights, for instance, also connect you with leading physicians, with this, yeah, I guess this kind of health data plugin, just kind of bringing all these disparate things together, say, into a platform or an app. Imagine the knock-on effect that would have on, say, global expenditure for, like social care, for instance, or hospital waiting lists. The NHS waiting list, for instance, is years for certain specialist treatments. And just imagine if you had the ability to take control of your own health and wellness through your phone and through, just make a different way of access.
And it could be automated through smart contracts, right? So you can literally say, hey, and you can get updates. It's like, by the way, there's a new smart contract analysis service that's been released that, improves health outcomes by 20%, or fitness by 20%, or sleep by 50%. Like, and you could just upgrade your own software yourself. And so all of a sudden now people are exchanging tips on, hey, I just like sleep maxed, I just increased my sleep quality by 20%. And I just increased my fitness or my muscle strength, or by the way, the methylation on my genome is looking better. And so I'm looking younger, Brian Johnson's thing of like, I'm aging much slower than most people. It would be incredible. And it would bring innovation and honestly revenue, and then DeFi that we could run on top of that. So then it's like, well, then you can start doing really just incredible decentralized finance on top of decentralized science.
Exactly. Yeah, I mean, we're just kind of riffing off these ideas now, and it just goes to show that there are so many potential applications, and also we're so early. And I really like the fact that, we're here, Sei is here, and we also want to help nurture any founders, also Web2 companies who are looking at these potential applications and wanting to build in DeSci. And yeah, I mean, I really just want to see this Cambrian explosion of DeSci applications. That's just going to totally change the way in which global health is at the moment.
Yeah, couldn't agree more. So, Eleanor, thank you so much for having you here. Super excited about all the work that you're doing at the Sei Foundation and in DeSci, and very excited for our next conversation because I know you're fostering a lot of really interesting ideas and companies right now, and so you'll be able to talk about it much more over the next couple of months or year or two. And so we're excited about that. I think for any scientists or founders that are thinking of building a DeSci company or protocol, should they just reach out to you directly?
Exactly. So you can reach out to me on X. So I am at Gwei_Shah. There's a triple pun in there. Or you can email me at Eleanor, ELEANOR, at sayfdn.org.
Awesome. Thank you, Eleanor, and very excited about the future of DeSci on Sei. All
Yes.
right.
Yeah, me too.
Thank you
Thanks
so
so
much.
much.
Thanks for joining us.